in January this year, the Nigerian Association of Resident Doctors at Enugu State University of Science and Technology Teaching Hospital commended Governor Peter Mbah for employing 100 resident doctors, consultants and other support staff to address manpower shortage in the state's health sector. That singular act was one of eloquent testimony in a support of how transformative the governor has been in his handling of primary health care as one of the paramount thresholds of his administration. Dr. Yomi Jaye is Governor Peter Mbah's special advisor on health. He joins us now, and thanks for being with us today.
Good afternoon, Nigerians.
All right, Dr. Jaye, let's start with some specifics here. The Enugu State has announced plans for a 300-bed ultra-modern quaternary hospital, I hope I pronounced that right, aimed at reversing medical tourism in Nigeria. I'd like to know how feasible when it comes to fruition. And we also hear about 260 type 2 primary health care centers, as it were. So can you just give us a recap of all of this goings-ons regarding healthcare in your state?
So the common saying that health is a vital resource in the race of life. When health is challenged, every other thing loses value. And that's why everybody says health is wealth. Barrister Peter Mbah realizes this, and he takes it very important. And then he looks at all the levels of healthcare across board. The primary healthcare, which takes care of the 60 to 80% of healthcare needs, and that is the one that reaches the grassroots, that reaches everybody. Then the secondary care, where we have the cottage hospitals and the general hospitals. And then the tertiary hospitals, where you have the teaching hospitals. So we look at the challenges we met on ground in terms of how these places were not functioning. And we began to look at them. One, we look at what are the challenges at the primary healthcare. So we are looking at putting up 260 in each ward. We have 260 wards in Enugu State. So it is just a common knowledge to have at least one primary healthcare in there. So we are putting that up. As we speak, 30 of those are already in space and then are already completed, and then the remaining have been launched out in the next few weeks. So that because we had to do a study, deep dive, not just jump in, we want to build. Yeah. No, I mean, His Excellency is a very technical person when it comes to details. Then we also took time to look at what are the challenges in the secondary care. Secondary care provides support or be able to solve problems of the primary care that the primary care cannot attend to. So we looked at deep dive, look at all the general hospitals and the cottage hospitals. And then the chairman or executive secretary or executive chairman of that agency went around as in person with evidences, because His Excellency said, I want to see what it was and what we are taking it to. So we are putting it up, ensuring that there is all the facilities, surgeries, diagnostics, among other things. Then tertiary, because there are challenges that cannot be solved at the secondary care. Yeah. So right as we speak, there is a huge twin 6-floor building going on at the Enugu State Teaching Hospital at Park Lane to improve the face of that facility, to create more space. It's already jam-packed. We want to see how we can take it up to a reasonable level. And we have a target. Before the turn of the year, we want to open this to the public. So that is going on. But we also realize that Nigeria contributes hugely to medical tourism globally. And when we look at it, the cost of moving a patient down alone is enough to take care of the patient if we have the facility. So why can't we think in that way? That's why the 300-bed multi-specialist, super specialist facility is being come up with.
Fantastic. It's great to know that in spite of the challenges like you hinted that you met on ground, that these facilities were not functional, that you're aiming to make sure that the opposite is the case. And let's talk about the human resources that would actually make this these facilities come to life. We understand, you touched on this, the Park Lane, that's the Enugu State University of Science and Technology at Park Lane that is being worked on, and you intend to train as many as 3,000 nurses annually from the current 50. That's a big dream. That's a big number. So can you tell us about the details regarding that, especially when it comes to retaining the 3,000?
So in terms of human resource, see, there is a challenge about that, because we will say there is a lot of, there are no healthcare professionals. Yeah. But you put advert out for 400 people and then 7,000 applied. Where are they coming from? So we need to now see that maybe we are not providing the right environment for the people to work. Maybe not necessarily everybody has jackpot, right? So the intention is to ensure that we have adequate number of people. We are building 260, among others, primary health care. We need midwives, we need doctors to man those places. We are improving on the general hospitals that we don't have enough healthcare resource. Yeah. We need people. We are also building the tertiary. We need people. So we went to look at what is happening in our training facilities, not just the nursing. We feel that we are producing just 50 nurses every year. It is terrible. For my people at home in Enugu, they will say, Ojoronjo, it's bad. Yeah. So His Excellency said, no, this is a massive, we need to launch into this. And you say, if you want to dream, if you say, I will get into the sky, you may not reach sky, you may drop at the middle. But if you say you want to reach the moon, audacious goal, that's what changes the world. So that's the kind of mindset that His Excellency is creating. So we went through all the regulatory. Right now, admission process is going on, and we've encouraged the populace to come into the school. We want to start with the ones that we've approved us for, and then we can scale up from there. So retaining them, no matter what you do, in the best of situations, people will always migrate. And it's a labor law. It's a free world. You can work anywhere in the world. But the law to make sure that you don't get scarce is output must not be more than input. So we want to see how we can increase that. And I think is also the approach the federal government is putting on. We increase that, not just increase that and put them out. We want to see how they can have good working environment. And we are putting a lot of things in place. Last week, we had a meeting together with the commissioner to ensure that the working environment will be improved for our people.
Indeed. Audacity to dare, as it were. All right, Dr. Yomi Jaye, Special Advisor on Health at Enugu State, would like to thank you very much for your thoughts and wish you all the best.